So, hello and good afternoon from the United Kingdom, and good morning from America. Thank you for joining myself, Matt Daly, and the Nightingale Challenge team for the third webinar in a series building up to the launch of the Nursing Now 2020 campaign. The Nursing Now campaign and the part the Nightingale Challenge plays in this is our opportunity to continue the legacy handed on to us from Nightingale and past nursing and midwifery leaders by improving global health, by raising the profile and status of nursing midwifery worldwide in collaboration with the World Health Organization and the International Council of Nurses. It seeks to empower us as nurses and midwives, regardless of our location in the world, to take our place in the fight against 21st century health challenges by encouraging greater investment in our workforce, recruiting more of us to senior leadership positions in healthcare, and our sharing of good practices, conducting research into the areas of greatest impact, and allow us to have a more prominent voice in healthcare policy making. Further information can be found online on the dedicated Nightingale Challenge webpage with much more detail on global and regional activities, participants and resources. So now, please let me introduce our host for this webinar, David Benton, Chief Executive of the National Council of State Boards of Nursing at Chicago, Illinois, in the US, where he's been there since 2015. He's the former CEO of the International Council of Nurses and consultant on nursing and health policy, specializing in regulation, licensing, and education. David qualified as a general and mental health nurse at the then Highland College of Nursing, Midwifery in Inverness, Scotland. And over the past 30 years, he has held senior roles as Executive Director of Nursing, Senior Civil Servant in Northern and Yorkshire region of England, and Chief Executive of a nurse regulatory body in Scotland, and as Nurse Director of a University Trust Health System. The title of our webinar today is Nursing Regulation, Global Patient Protection, where we explore the regulation of professional nursing practice, how this allows public protection by using nurses as advocates, and how this knowledge aids nurses in strengthening influence. We will have time for questions and answers at the end of the presentation. Thank you. Over to you, David.
Thanks very much, Matt. So let me start by just giving you a very brief outline of the material I'm going to cover. I mean, first of all, I think it's important that we set this within a historical context, but also link it to my own personal journey in terms of how I have had an interest in regulation over the past 40 years. I would say that regulation is an evolving science, and one that I will actually point to some of the reasons for that and some of the things that we need to do. We also need to think about how we will change regulation and what role we as nurses will have in informing our governments, society, and the profession in terms of the changes that are needed to keep step with the needs of society. And then I'll talk a little bit about some of the future-orientated regulatory agenda that I believe we should all be engaged in. So it's interesting that Nightingale herself was actually opposed to professional regulation, although in this very early letter that she sent to her probationers, it really indicates the very essence of regulation. If we're not able to control ourselves, how can we actually work for others? It's important that we think about how regulation fits within today's society. In Nightingale's day, when the discussion about the establishment of regulation started, and the work that was being done in New Zealand, the United States, the United Kingdom, we're over 100 years of regulation now in the UK and several other countries around the world. But that was the industrial era, an era where we tended to have limited mobility and we would have limited technologies. Today, of course, we're now living in a complex digital age, an age where mobility is the norm and technology is an essential component. These are some of the changes that are taking place in our healthcare delivery system. And I do not intend to go through all of these, but needless to say, I wish to say that each of these has a direct impact on the regulatory systems that we need if we are to meet today's challenges and meet the needs of a healthcare system that is evolving rapidly, using technology frequently, and has able to increase access both directly, locally, but at a distance as well. Now, this is a quote from former President Barack Obama, and it's an interesting analysis of some of the issues that's happening within the regulatory space. If regulation is to be fit for the future, of course it has to protect the public, but it also has to be innovative and it has to be proportionate, because if it is overly oppressive, then it will restrict the change that is needed to meet the demands of patients of today. We need to think about how we can have an effective and efficient regulatory system while simultaneously protecting the public and advancing the profession to meet societal needs. One way of defining regulation is to look at its component parts. We need to think about the purpose of regulation, the means by which we can deliver regulation, who indeed will be regulated, the subjects, the mechanisms, and importantly, the outcomes. In today's world, regulation is there to protect the public, but it is also to facilitate efficient and effective jurisdictional movement. We no longer are born, live, work, and die in a single jurisdiction. It is frequently the case that people move around, and as such, our qualifications need to be able to move with us. We also need to remember that as health needs changes, regulation needs to change as well. And this is essential if we are to keep pace and not obstruct the reform of healthcare delivery systems that are much needed in many parts of the world. But regulation of the nursing profession is only one component part. As nurses, we are part of a larger group of healthcare professions. That in itself is part of the group of professional licensure, which is part of occupational licensure, which is part of the regulation of systems per se. So we need to think about the fact that the work that we are doing has to interact and relate with others. So as nurses, we should not simply be focusing on our own regulation, but thinking about how that relates to the wider team and how it relates to society. We need to reach across boundaries and work together on the regulatory reform agenda. This slide, and again, I'm not going to go into it in detail, but if I draw your attention to the left-hand side of the slide in the grey area, regulation can be state-based or it can be profession-based. It can be located as part of the health ministry or indeed other ministries, or it may be professionally established as an independent entity. But in reality, around the world, most of the regulatory systems that are established sits in between, where there is an arm's length relationship between government and the profession, where the need to protect the public is paramount. Now, each of these models have relative advantages, the green area, and disadvantages, the blue area. And again, I will not go into these in detail, but it is important as we reform regulation to be mindful of both the advantages and disadvantages of the different solutions that we can bring to bear. Being knowledgeable as nurses, having the discussion with legislators in a way that informs them about these relative advantages and disadvantages can help us redesign a regulatory system fit for the future. A piece of work that we did at the National Council of State Boards of Nursing was to analyse the entire global literature on professional regulation. And from that work, we were able to identify 7 categories. Each category had a number of themes, and we identified that those themes evolved over time. What you can see here is an example of only part of the table. But in reality, I ended up, as I said, with 7 themes: technology and information, governance, purpose and processes, licensees and registrants, workforce, education, and fitness for practice. Each of these had the sub-elements which enabled us to track evolution over time. We convened a group of individuals from around the world, nurses and other health disciplines, but also representatives from the Organization for Economic Cooperation and Development, from the World Health Organization, from the Federal Trade Commission, and indeed some legislators. And we asked them to take those individual evolving themes and work on them in a way that would develop the thinking over time. So if we take, for example, from the governance cluster, the nature of the regulator, it evolved from a set of guilds through autonomous bodies and ministerial departments to accountable bodies that are either individual or part of umbrella structures, to now a model where performance management of these bodies is increasingly becoming the norm and where there is independent oversight looking at their performance. We took these concepts and put them at the center of a map. And we asked individuals to say, well, if this is the emerging theme, where might it take us in the future? And if we can see that those are positive places, then we asked the question, how can we accelerate movement towards that? If we saw that some of the potential futures were detrimental to public safety, then we could say, well, how can we divert this trend in a way that is more positive? This looks rather messy. And what we then did was we digitized each of these 25 maps into much more coherent mappings of the various elements. We then took each of these maps and analyzed them collectively to identify 4 overarching focusing concepts. So the 25 maps identified the issue of collaboration as an essential requirement for moving forward regulatory reform, the need for performance measures and metrics, the need to radically look at the governance of regulatory bodies, and also how we would use data and technology into the future. So as a synopsis, we identified 25 regulatory trends that then were distilled down to 4 focusing concepts that then provided us with a set of challenging yet achievable objectives. And we believe that this will lead to a regulatory model that is indeed fit for the digital age. As part of this project, we identified that the regulators themselves needed to change. They needed to have enhanced communication, change management, performance management, quality improvement, policy, board development, strategic partnering, and data analytic and economics skills if we were to modernize the healthcare regulatory system. Now, what we have around the world is a number of jurisdictions. In the United States, the nursing profession is regulated at the state level. In other places, it may be at the country level. In Brazil, there is a sharing of power between federal government and state government. And one of the things that we've done as an organization is to gather that information together. And we have on our regulatoryatlas.com website information on how the profession is regulated globally. We have information from 320 jurisdictions covering the regulation of 20.6 million nurses. In Africa, there are 44 jurisdictions, in Asia 81, Australia and Oceania 17, Europe 45, North America 96, and South America 20. And we've looked at the governance, the licensing, the education, discipline, how telehealth is evolving, and nursing research on regulation in each of these. So by going to the website, information is available in terms of how you can learn about regulation in other parts of the world. We can use that to inform changes that we may wish to see in our own jurisdiction, or we can reach out to colleagues in other parts of the world to give us advice and help us as we move forward with our own set of changes. Now, I did mention that it is important that regulators are held accountable. And this slide indicates that to do so, there are 4 major areas that we need to look at. We need to look at our performance in relation to how the legislation, advocacy, and responsiveness to the system is orchestrated, how our regulatory body is organized and its internal governance, but also importantly, how we relate to the external stakeholders to nurses themselves, to the public, to legislators, to educators, and to all those that are involved in these processes. We also need to be very clear about the tasks that we have been given to do by legislation and make sure that we deliver them efficiently and effectively, the responsibilities and functions that we hold. So all of this means that we are facing a time of incredible change, a time when we all need to work together to reform regulation in a way that actually helps us deliver services to the many needed individuals around the world. Now, one of the issues that is gathering a lot of attention at the moment is the concept of continuing competence. Not continuing education, but continuing competence. Historically, regulators have tended to look at this from a bad apple type model. Our regulatory system identifies those that have got problems, we focus in on them, and then we deal with them. And what needs to happen is, instead of actually looking just at those that are failing to perform, we should think about how we improve the entire system by moving forward the entire performance of our registrants. So shifting the curve to the right. And by doing so, what you see is a fundamental reduction in the number of issues. That requires us to be much more interactive with licensees of today. We need to engage with them on an ongoing basis and use their experiences of day-to-day practice to inform where regulation is going into the future. Now, the good news is that nursing is actually doing rather well in terms of informing the nursing regulatory change. This is a slide which identifies the work that's been done within different disciplines. The top 5 disciplines were assessed in terms of their volume of research that they're doing, but also the quality of that research. Articles and reviews tend to be research-based, whereas the others tend to have more opinion-based aspects. So if we look at the entire literature, this is information that was distilled from Scopus, we see that overall about 74.2% of articles that have been written on regulation across all disciplines, and that includes engineering, veterinarians, etc. So that's the average benchmark. As you can see, nursing is doing better than average. 88.5% of our publications are research-based. Next comes law with 88.3, then economics with 81.4, and then education and medicine. So it is important that nursing takes its voice, takes its research, and uses it to inform government, to inform the future of regulation. So this slide, unfortunately, you cannot see the detail on the right-hand side of the slide because it's supposed to be animated, and with a difficulty that we had in setting up the webinar, we're not able to have the animation on the side. But let me just walk you through the elements on the left-hand side of the screen. These are distilled from the work of the Strengthening Nursing and Midwifery strategies that the World Health Organization have been implementing over a number of cycles. They focus on workforce management, positive practice environments, scaling up nursing and midwifery capacity, access and quality of education, strengthening regulatory capacity, and research and evidence-based. I would argue that each of these, there is opportunities in terms of regulatory reform. In relation to the workforce management, we need to use computer-based systems to capture data in real time to enable us to see how practitioners are practicing in the here and now, not simply on a sample basis every 3 to 5 years. In terms of positive practice environments, we need to think about how we can work together with service and education and regulation to make sure that the environment is good both for the practitioner and also the recipient of care. Those settings of care will of course change, moving away from hospitalized care delivery to much more dynamic community-based services. How do we scale this up? Well, we need to reform the curriculum. We need to think about how we use education in a timely way that only gives people the education they need, not overeducated and not undereducated. And it must be articulated so people can progress from one level of practice to the next. We also need to think about how our education systems are andragogically, they're learner-based rather than teacher-based as part of that process. And we also need to think about how we strengthen regulatory capacity. To do this, we need to invest in regulators themselves. We must learn from each other. We must network across the 320 regulatory jurisdictions so that we can take the best practices and implement them as speedily as possible so that we can really keep pace with the demands of today's society. And of course, whilst we're doing well in terms of regulatory research, we need to do more. We need to continue to push forward the boundaries and make sure that regulation is evidence-based rather than opinion-led. So to conclude, there are two major publications that NCSBN has published recently in relation to the reform of regulation. Both of these are available as free downloads from the NCSBN website or from the Journal of Nursing Regulation website. One entitled Regulation 2030, First Steps of a Journey, documents the work that regulators have been doing in terms of the evolution over time and points in the direction of where we need to go in the future. If you will, the 25 regulatory maps that I showed one example of earlier. The second publication is entitled Acting in the Public Interest. This was developed collaboratively with a group of regulators from around the world. We were able to draw on our experience, not just in developed countries, but in developing countries as well. In countries that used civil law frameworks or Islamic law frameworks or common law frameworks, and distill from that what it really means to be acting in the public interest. We know from historical analysis that this concept has been changing. We know that at the moment, regulators are often criticized for not being responsive enough. This publication documents all of the challenges that are being raised by government so that we can address them in a systematic and speedy way, so that regulators and the profession of nursing can be seen as part of the solution, leading the way rather than being a barrier to change. These are essential elements in terms of where we need to go for the future. As we come to the start of the celebrations of 200 years of Florence Nightingale's birth, we need to look back to inform our decisions for the future, but we must keep our eye on the horizon. We must look to see what we need to deal with tomorrow, not yesterday. We learn from the past, but we must not be stuck in the past. That is the challenge that we as regulators, we as the nursing profession have, if we are to provide accessible, quality care to all those that need it around the globe. There are a number of references that are available, so if people wish to look at some of these issues in much greater detail, you can access these from the slide deck. And I would be happy now to take any questions that you may have or elaborate on any of the points that I have made. Thank you.
Okay, the floor's open for any questions. Does anyone have any questions, please? I do have several. Okay, David, so at this time of great change, how can nurses get more involved in regulation, and why is it important to do so?
So the first thing is there are many ways that nursing can get involved in regulation. And first of all, I need to point out that regulation is at different stages of development around the world. In some countries, in some jurisdictions, regulation has been established for more than a century. However, in other countries, regulation is only starting to be established. So it is important that we, as nurses, collaborate with each other and share our experiences so that those countries that are starting the journey can basically leapfrog ahead and avoid some of the mistakes that we have made in the past and really move forward at a rapid pace. Now, we can do this in a number of ways. Increasingly, regulators have websites. They consult on the work that they're doing, and therefore I would encourage people to reach out to those websites on a regular basis, see what the regulator is doing, the changes that they are proposing, and make contributions as part of that process. As frontline nurses, it is imperative that we share the experiences of today so that the regulators can support us in a way that enables us to deliver high quality, safe care. We can only do that as regulators if we know accurately what is needed of nurses in the front line. Now, another way that we can do this to involve ourselves is to attend some of the meetings that regulators host. Increasingly, what I see in the United States and indeed in some other countries is where education is actually reaching out to the regulator and facilitating their students to attend some of the meetings of the regulators as observers. So they understand not only the work that the regulator is doing, but also have an opportunity to talk to the regulators themselves and share their thinking with the regulators and raise the issues that they believe are confronting them. For example, if we think about the way that technology is now impacting on our care, we need to be sharing those differences with the regulator so that they can focus on these changes ahead of time rather than in retrospect. Finally, I would say that one of the things that we are increasingly seeing is regulators undertaking research or providing opportunities for people to come and act as interns with the regulators. So here at the National Council of State Boards of Nursing, we have an internship scheme where people can come and work with us over the summer holidays and do projects, meaningful projects, and they can see that the contribution that they are making is valuing the advancement of the profession. We also have funding available for those that wish to conduct research, and that can be, people can bid for that funding twice a year, and by going to our website, you can get information on that.
That's lovely, thank you. I've got some more questions coming through. So from Lisa, there is, what are some of the best practices in terms of integrating more equity, diversity and culture into our regulatory outcomes with increasing indicators?
So the first thing I would say is that you've got to actually look at know exactly where you are at this moment in time. So have a good database to look at what metrics you are looking at in terms of diversity. So because if you don't know where you are, you can't actually measure whether you've actually made any progress. So that's the first point. The second point is that we've got to recognize that to have a diverse workforce, we actually need to think about how some of the barriers to diversity are addressed. If you think about some of my friends that have progressed really well in the profession, they've not always taken a traditional route. So making sure that there are diverse routes into the profession is important. Thinking about how there could be an articulation from support workers through licensed practical nurses to registered nurses to advanced practice. All of these things facilitate diversity, and also making sure that when someone has got the necessary competencies, they don't have to reinvent and redo those competencies. So looking at a model which is modular, that is competency based, that has step on and step off points. If you think about some of the work that has been done in the UK, the Peach Commission quite a number of years ago introduced the concept of stepping on and stepping off. As we've moved into higher education, the idea of accreditation for prior learning is something that can be accepted and can actually help facilitate this. And thinking about the fact that in society now, many people do not enter the profession as a career for life, but they will in fact have several careers. So making it possible for people to come into the profession after some other life experiences is important in a way that builds on those experiences and uses them to the advantage of society. We need to think about diversity in a wide range of mechanisms. Experience, linguistic, cultural, many other aspects all need to be considered in terms of the metrics that we use, and not simply ethnicity as a major dimension, but all of these factors need to be considered.
Okay, that's lovely, thank you. A question from Paula Spooner is, how do you feel about the regulation, or how do you feel about advanced practice nursing in England not being regulated? And do you have any suggestions on how this could be influenced?
So if you think about so in the United States and in some countries, advanced practice nursing is regulated. And the reason for that being that there is some specific additional responsibilities that the regulator has, that the practitioner has as part of that process. And I think what we've got to look at, particularly as we look at increasing access to services, is the fact that advanced practice nurses are often working in remote and rural communities. They're working in a way where they're providing a broad range of services, and therefore we need to think about how the public is protected as part of that process. So I think part of what we have to do in this is to actually look at where this is going on a global stage, to look at the best practices that there are from around the world, and looking at the need for regulation where it has a tangible benefit in terms of public protection. So it's not simply about regulation for the sake of it, but it's actually about regulation for the protection of the public and for the ability for the public to discern that they actually have a practitioner in front of them that actually has the necessary knowledge and skills to do the job that is being asked.
Lovely, thank you. A question from Ahmed. How could we engage young nurses or the youthful nurses into understanding how nursing regulation bodies work? How do we engage?
So I think the first thing is that we've actually, as regulatory bodies, we've got to be far more visible. We actually need to communicate the fact that we're there to provide the standards, the educational standards, the practice standards, the codes of conduct as part of that. That's part of it, but we actually need to be much more accessible. Now, what we've seen in the past around the world is regulators reaching out and making themselves more visible, both to the profession itself, because sometimes the profession doesn't understand fully what it is that we as regulators do, but also to the public, and encouraging people into the profession at a much earlier stage, so they have role models and see how nursing is changing as a discipline and how it contributes to the access, the quality, and indeed the affordability of services. So I think as regulators, we should encourage the use of social media so that they can, the public and the profession can interact with us on a regular basis. They can use that as a forum to draw attention to issues that are on their mind. But we also need to be out and about, having events where people can come and ask questions in a way that informs them and shapes their thinking for the future.
That's lovely, thank you. One question from Sean. You highlighted in the literature and regulation with reference to the legal profession. So his question is, what are your comments on what we can learn from the difference in regulatory differences between, say, the English or Scottish bar? Very much at arm's length, but in terms of ensuring that the standards of practice and conduct is readily used and understood by practitioners.
So I would say that to really advance ourselves, we need to look at other disciplines that are regulated, such as the legal profession, but we should also look outside of the traditional professions. Look at, for example, accountancy or architecture or some of these other disciplines that are truly global as well, and see what we can learn from there. I think the best piece of advice that I was ever given by one of my managers, and my manager at the time was Judith Lavender. She was the Director of Nursing in North East Essex Health Authority. And what she said to me was, the power of comparison should not be underestimated. And therefore, by reaching out and looking at how others do things, we learn so much from them, but we also ask questions of ourselves. So I think the more that we can reach out to other disciplines, see how they approach issues, reach out to other countries and see how they do it as well. So whether you're talking about the Scottish legal system and the English legal system, there's learning there to be had, but there's also learning to be had from looking at how our profession works in different parts of the world. And certainly when Judy gave me that advice, I was fortunate enough to apply for and receive a Florence Nightingale travel scholarship, which enabled me to visit the United States and look at how research active environments improve the quality of care. Now that was now almost 30 years ago, and I still find still connected to those nurses that I met at the time. It's a lifetime friendship, but it's also a journey of learning that we have continued to stimulate over the years.
Lovely, thank you. Probably last question now. How can regulation influence the public's opinion of the nursing midwifery professions, do you think?
Well, I think one of the things is that we need to talk more about our successes. Quite rightly, when things go wrong, that is the focus, and questions need to be asked, and we certainly need to continue to do that. But we also need to talk about the successes that we have. If you think about the number of nursing interactions that take place in any country any day of the week, it's hundreds of thousands. It's into the millions. Yet the number of problems that we see globally is less than 1% of nurses come to the attention of the regulator. So the regulator is doing a fabulous job. Now, is it doing enough? Is it doing it fast enough? These are the questions I believe that as regulators we need to address. We need to have a set of performance metrics that demonstrate to the public, to the profession, and to the politicians that we are doing the very best we can in the most efficient and effective way to protect the public, to align the profession with the changing needs of society. Those are the challenges that we now face, and it can only be brought about by being more transparent, more communicative, and more accountable through the identification of these metrics and the promotion of these metrics in a way that begs questions about how can we continue to improve. Performance is something that is never complete. It's something that you continue to move forward as the context of care changes, and therefore looking at how we continuously improve regulation is the challenge for today, for tomorrow, and into the future.
That's lovely. Thank you ever so much for this. Thank you everyone for your questions and spending time with us today. Please look out for details of the forthcoming webinars in November, or coming up soon in December, sorry, and that'll be distributed to you in the near future. So today, 15,181 nurses and midwives from 380 employers in 52 countries have joined the challenge, and we encourage others to do so, as well as sharing details of the Nightingale Challenge across your network, and to encourage others to accept the Nightingale Challenge. And it just takes a few minutes online to join, and to spread the word by sharing, posting, and reposting support from the Nightingale Challenge on social media platforms and at any events and conferences using the Twitter hashtag Nightingale Challenge. Thank you very much for joining us today, and thank you, David. It's really pleasurable listening to you talk. I've learned a lot myself. Thank you very much.
Thank you. Bye-bye.